Hi, class. It's Dr. Lindner. Let's take a look at lipids. Lipids, when we think of lipids, we think of fats, right? We use those terms interchangeably, but you'll see that lipids have different classifications. We have fatty acids, triglycerides, phospholipids, steroids, eicosanoids, and then other lipids. And I'm going to repeat these a few times throughout this PowerPoint presentation. Now, fatty acids, when we think of fatty acids, it's used to synthesize triglycerides and phospholipids, or they're catabolized to generate ATP. Okay, those are fatty acids. Triglycerides, these are used for protection, for insulation, and also for energy storage. So when people have high triglycerides, that's no good, right? Too much of it is a risk factor for heart disease. They need to exercise a little bit more. It just means they have lots of stored energy that needs to be used. Phospholipids, phospholipids is made up of a phosphate group and then lipids, saturated and unsaturated. And these are involved. This is the phosphate portion, which is like phosphorus, and then four oxygens. We have PO4. Phospholipids, phosphate and lipid. These make the lipid component of your cell membrane. The cell membrane is a phospholipid bilayer. When you look at my video on the cell and the cell membrane, you'll see these phospholipids. It's a very, very important part of the cell membrane. Then we have steroids like cholesterol, bile salts, vitamin D, sex hormones, and adrenal cortical hormones. Now, cholesterol, steroid, sex hormones, estrogen, progesterone, testosterone, they all come from steroids. So we need cholesterol. Cholesterol is a component of the cell membrane. The brain is mostly fat and cholesterol. It's a precursor to bile salts. Cholesterol is needed to make vitamin D, and it's needed to make steroid hormones. Okay. The steroid hormones, some of them are sex hormones: estrogen, progesterone, testosterone. Bile salts, these are found in the gallbladder. These are needed for the digestion and the absorption of lipids. To break them down, we need bile salts. Vitamin D helps to regulate calcium levels in the body, and it's also needed for bone growth and repair. And every single organ within the body actually has vitamin D receptors. In the Northeast, we tend to have some challenges in making of vitamin D because we need sunlight. We need those UV rays that come down and hit the subcutaneous cholesterol on the skin. And then we make these vitamin D precursors that go to the liver, first. And then after the liver makes some vitamin D precursors. And then it goes to the kidneys where it makes the bioavailable form of vitamin D. Okay. So the liver makes 25 hydroxide and the kidneys make 125 hydroxide. When we test for vitamin D on blood, we're testing this 25 hydroxide. Okay? You want that somewhere around, the magic number tends to be 55. Although if you look at most of the labs, they'll say anything between 30 and 100 is normal. But the ideal number is somewhere around 55 to 60, okay, for vitamin D. And if you're supplementing vitamin D, it's always based on the blood results, and you never want to take vitamin D, which is the form that we use is called D3, without vitamin K. So D3 with K in the formulation is a must. If you're taking D3 by itself, I would stop and go right to D3 with K, because D allows you to absorb calcium, but you don't want that calcium stagnating in blood vessels. You want vitamin K to help drive the calcium out of blood vessels and into the bone. So vitamin K is needed for something called matrix GLA protein or GLA matrix protein. And that GLA matrix protein or matrix GLA protein drives the calcium in the bone. Okay, adrenocortical hormones help regulate metabolism, resistance to stress, and salt and water balance. So when you look at adrenocortical hormone, when you see adrenal and cortico, so if this is a cross section of the adrenal gland, there's this outer portion and an inner portion. And this outer portion that I'm coloring in, that's the cortex. And the inner portion is the medulla. So the adrenocortical hormones are the hormones produced in the cortex in the outer part of the adrenal gland. And that's going to be like cortisol, cortisone, corticosterone, aldosterone. Those are all produced in the adrenal cortex. Sex hormones, these stimulate the production and function of the sexual characteristics. So estrogen, testosterone, progesterone. So steroids are really, really important. Eicosanoids, which involve prostaglandins and leukotrienes. I do have a slide just on that alone. But these have diverse effects on modifying responses to hormones, blood clotting, big time inflammation, immunity, stomach acid secretion, smooth muscle contraction. Like you need these to allow this to function. But if you're in pain, if you have inflammation and you take a painkiller, if you take a ibuprofen or an aspirin, these are prostaglandin blockers. So inflammation goes away, but so does the ability to secrete stomach acid. Then that decreases. And then so does your ability to produce a fever. So does your ability for smooth muscle contraction. Okay, so these things have great important functions, and if we manipulate them, long term there's problems. If you take aspirin, that will involve your blood clotting, right? Okay, other lipids, other fats. We have some fat soluble vitamins, vitamins A, D, E, and K. Carotene or carotenoids. These are needed for our body to produce vitamin A, which is involved in eye function. And it's also an antioxidant, as is vitamin E. Very powerful antioxidant, but it's also involved in wound healing. It helps to prevent scarring. It's involved in healthy functioning of the neural system. And vitamin E is also involved in fertility. Vitamin E and fertility. Your vitamin K is involved in blood clotting, and it also is very important for driving calcium into bones. And we have lipoprotein. These transport lipids in blood, and they carry triglycerides and cholesterol to the tissues. So low density lipoprotein and high density lipoprotein. The lipoprotein are the carriers, they're transporters. Okay. So the LDL brings cholesterol from your liver to all parts of your body. And whatever cholesterol your body doesn't want or need, the HDL is like the antioxidant that scoops up the cholesterol, brings it back to the liver for storage. So fatty acids can be saturated or unsaturated. So when you see a long carbon chain, look, here's a long carbon chain. You see every carbon is saturated with hydrogens. And then here, look what we have at the end. Look at that functional group, COOH. That's a carboxyl group. Then we look underneath, there's a long carbon chain, but look right here, that's a double bond. And there's only one of them. The double bond creates a kink, it creates a little flexibility. It's not saturated, it's unsaturated. It's unsaturated, and because there's one double bond, it's a mono unsaturated. If you have two double bonds, then it's poly unsaturated fats. Okay? And if you look at the names, the amount of carbons and the amount of covalent bonds or double bonds give it different names. So this is palmitic acid, this is oleic acid, this is saturated and unsaturated. And if I put a phosphate group here, that's a phospholipid. As a saturated and unsaturated fat, that's involved in making up your cell membranes. Down below, here's how we can start to make, look what they're doing here with dehydration synthesis. There's a glycerol backbone, right? It's just a bunch of carbons with hydrogens and hydroxyl groups. And now we want to add a fatty acid to this. If we're going from something smaller and we're adding something to it, here's the carboxyl group, COOH. Now it's taking an oxygen and two hydrogens, pulling out water. That's dehydration synthesis. Now we could do it 3 times, 1, 2, 3, and you're pulling out water 3 times. Now we're making, here is a monoglyceride. If you have 2, diglyceride. And if you have 3 fatty chains, it's a triglyceride. And each time they pulled out the H2O, they pulled out a hydrogen and an oxygen to create the linkage here. Saturated, saturated, there's a double bond, unsaturated. Palmitic, stearic, and oleic acid. Again, you don't have to memorize the names of these, but just want you to understand the concept of how dehydration synthesis went from making something smaller into something larger. And the triglycerides are involved with protection, insulation, and for energy. Here's our phospholipid. You can see here's your phosphate group, your PO4. This is a saturated fat. And this one has a double bond right here. It's an unsaturated fat. So the cell membrane, we call it a phospholipid bilayer because here's one group of this, and on the other side is another. So it's a phospholipid bilayer. The outside portion is hydrophilic, likes water, and this side likes water. The inside is hydrophobic, doesn't like water. So the phospholipid consists of a lipid joined by a phosphate. They make up the structural component of a cell, but phospholipids are also used to emulsify and break down fats. They have a phosphate group, which is the PO4, and then they have the lipid or the fatty acids. That's hydrophobic. The phosphate is hydrophilic. We go back. This part is hydrophilic. This part is hydrophilic, but the inner part of the membrane is hydrophobic, doesn't like water. So again, you can see here is the head. These are the tails. They make up the cell wall or the cell membrane. This part likes water, hydrophilic. This part likes water, hydrophilic, but the inner part is hydrophobic. Again, you can see saturated fat, unsaturated. See the bend? This gives the cell membrane some flexibility. This gives it a strong structure. These are just some examples of the steroids, right? Cholesterol, the sex hormones, estradiol, testosterone, cortisol. These are just different types of steroids, right? And it makes you realize how important cholesterol is if it's the precursor to these. So when people use anti-lipidemic medications or cholesterol medications, you can really affect the sex hormones. You can affect vitamin D production. You can affect brain function, right? When you deplete cholesterol with a statin drugs block the body's ability to produce cholesterol. And in the same pathway that cholesterol is being produced, there's something called CoQ10 that's also needed. So if you're blocking cholesterol with a statin, you're also blocking CoQ10. And the reason why that becomes a problem is there's the mitochondria. The Krebs cycle takes place in there, and so does the electron transport chain. And the Krebs cycle that takes place in here needs your B vitamins, B1, B2, and B3, but the electron transport chain needs iron, it needs magnesium, and it needs CoQ10. And if you don't have that, you're going to have a big problem making ATP. If you don't have ATP production, then that means you don't have energy. When muscles don't have energy, they cry in pain. Muscles are called myo, like myology. When muscles have pain, we call it myalgia. When nerves have pain, we call it neuralgia. And there are dementia like symptoms or cognitive impairment when you have a mitochondria that's not working properly due to depleted CoQ10, because mitochondria are highly concentrated in the brain and in muscles. So you get myalgias and neuralgias, you get nerve pain, paresthesia, numbness and tingling, you get muscle aches and pains, and you get arthralgia, joint aches and pains, all linked to long-term statin use. You get the dementia because the brain is composed of cholesterol. It needs that to function properly. So you have to be very, very careful when taking anti-lipidemic medications or statins and be aware of their adverse reactions and at least supplement that which we know it depletes. So taking CoQ10 would be very important, especially in the form ubiquinol. They also make it ubiquinone. It's a little bit cheaper. Ubiquinol is the expensive stuff. So cholesterol we spoke about. It's the structural basis of all the body's steroids. We ingest it with eggs, milk, cheese, and our liver makes 80% of the cholesterol that we need. Okay. If the liver is making it, then you know the statin drugs to lower cholesterol attack the liver. Okay, it goes after the smooth endoplasmic reticulum. It goes after the smooth endoplasmic reticulum of the hepatocyte, which makes cholesterol. Bile salts break down products of cholesterol. They're released by the liver in the digestive tract, and bile salts break down or emulsify fat, and we need it to absorb them. We already spoke about vitamin D, which is a fat-soluble vitamin that's produced in the skin with UV ultraviolet radiation hitting it. And we make these precursors that go to the liver and go to the kidneys. Vitamin D is needed for immune function. It's needed for calcium absorption. When you're taking D3 supplemental based on your blood chemistry, The 25 hydroxide is the test that you'll use. And again, you want that number somewhere between 55 and 60. If it's lower, that's when you would supplement. Usually in the Northeast, I have many of my patients starting at 5,000 international units. And then in 2, 3 months' time, sometimes 4 months, depending on where they were, we will reassess it and watch the number go up. Okay. But D3 is taken 5,000 international units with vitamin K in the formulation, never without. With it, it prevents vascular calcification. We don't want calcium sitting in blood vessels. We want to make sure the calcium is driven into the bones. Sex hormones like estrogen, progesterone, testosterone, these are needed for normal sexual function and development of our secondary sex characteristics. The adrenocortical hormones, again, like cortisol. Cortisol is a glucocorticoid. Remember, if this is a cross section of the adrenal gland, the outer part is called the cortex. Cortex means bark, like the bark of a tree, and the inside is the medulla. So glucocorticoids are produced here, glucocorticoids, as well as mineral corticoids. The glucocorticoids are cortisol, like cortisol, cortisone, corticosterone. The mineral corticoid is called aldosterone. And when our body releases aldosterone, it allows us to retain sodium. Like sodium is involved with sodium chloride, which is salt. And if you hold on to salt, you hold on to water. When you have aldosterone, that's one of the hormones that can increase your blood pressure. Okay. It's a metabolic hormone. It's needed to maintain blood glucose levels. And because of aldosterone, it regulates salt and water balance, which is just what I just mentioned. The vitamin A, the vitamin E, the vitamin K, these are fat soluble. Vitamin A, we talked about beta carotene or carotenoids. These are needed for the eye function. They're found in orange or pigmented vegetables and fruits. We think of carrots, sweet potatoes, they're pretty high in vitamin A. Vitamin E is ingested in plant products like wheat germ and green leafy vegetables. Very important for wound healing, fertility, neutralizes free radicals because they're antioxidant, as is vitamin A. And then vitamin K is made available by humans largely by the action of intestinal bacteria. So this is why when babies are born, depending on the state you live in, many states mandate and require vitamin K injection because a baby hasn't eaten yet. When they're born, they haven't eaten and the intestines are sterile, so the baby doesn't have the ability of making vitamin K. It's not until the baby breastfeeds that there's some bacterial generation in the intestines and the gut where now the baby can make vitamin K. Vitamin K is also needed for blood clotting and to drive calcium into the bones because of matrix GLA protein, which drives calcium into the bone. CoQ10, I mentioned, it's not a vitamin, it's a coenzyme, but it's needed by the mitochondria in the electron transport chain to help produce ATP. Your muscles need it, and the neural system needs it. Without it, you get myalgia and neuralgia, and the brain can get cognitive impairment. When you look at Lipitor, Crestor, Simvastatin, Arvastatin, any type of anti-lipidemic medication, the new black box warning on it is that they can cause cognitive impairment or dementia-like symptoms. The eicosanoids, these are lipid type derived from fatty acids called arachidonic acid. Arachidonic acid is in all of our cell membranes. So as the cell membrane becomes damaged, from that arachidonic acid, we can produce prostaglandins and leukotrienes. Okay, so from the arachidonic acid, we can produce prostaglandins or leukotrienes. And these are involved in pain, inflammation, and swelling especially the prostaglandins, pain, inflammation, and swelling. If we go back here, prostaglandins are needed for uterine contractions, muscle contraction. They're involved with inflammation. They're involved in producing stomach ulcers because prostaglandins produce mucus. They produce mucus in the stomach. So if here's the esophagus and here's the stomach and this is the intestine, we have these mucus cells that line the walls of the intestine. They make mucus, which protect the stomach. What do they protect it from? All the HCl, all the hydrochloric acid. So if you don't have mucus cells producing mucus, but we have hydrochloric acid, you're going to get an ulcer. All right. So prostaglandins prevent stomach ulcers. Prostaglandins open up the airways, they dilate them. They're involved in temperature regulation, and they're involved in the formation of clots. That's all prostaglandins. So if we take a prostaglandin blocker like aspirin or ibuprofen, your fever will come down, temperature will come down, a woman's menstrual cramps will come down, so will pain, inflammation, and swelling. The leukotrienes are involved with the lungs, like sinuses, allergies, the inflammation around the respiratory tract. So arachidonic acid converts into leukotrienes, and that creates inflammation and bronchial constriction or blockage of the airway obstruction. So you can take the enzyme that converts arachidonic acid and creates leukotrienes that are called lipoxygenase. So if we block lipoxygenase, we can't produce leukotrienes. Cyclogenase is the COX enzymes. Cyclogenase 1, cyclogenase 2, these are cyclogenase, these are lipoxygenase. So the COX enzyme 1 and 2, they affect different branches. So they have specific, like Celebrex is a COX-2 inhibitor. Aspirin and ibuprofen is a COX-1 inhibitor. Some of these can create damage to the lining of blood vessels and cause strokes. So they have to be very, very careful with certain medications. Okay. So these were the eicosanoids, very important. Okay, when we come back, we'll get into proteins.